Let's just totally bypass the ancient folklore today and get right into the cutting-edge science. Welcome to The Explainer. Today, we're analyzing the peer-reviewed clinical pharmacology of Curcuma longa. Honestly, forget everything you know about this plant as just a simple kitchen spice. Modern medical research suggests that Curcuma longa actually possesses these profound multi-targeted therapeutic benefits that operate at the deepest levels of our cellular biology. We're talking about highly active phytochemicals that can literally modulate complex disease pathways across your entire body.
So how exactly does Curcuma longa interact with our cellular pathways? Let's dive right into this. It isn't just, floating passively around in the bloodstream. It actively interacts with our cellular pathways, kind of like a master switchboard operator. Instead of targeting just one single receptor, research indicates its bioactive compounds simultaneously modulate inflammatory signals, oxidative stress markers, and even genetic transcription factors right inside our cells. Pretty amazing, right?
To really grasp the magnitude of all this, we're going to translate this dense medical research into accessible knowledge system by system. Our agenda today: number 1, joint pain and inflammation. 2, metabolic and liver health. 3, brain and cognitive resilience. 4, cardiovascular and renal support. And finally, number 5, antimicrobial and tissue healing.
All right, let's start with the structural framework of the body. Section 1, joint pain and inflammation.
Studies consistently indicate that Curcuma longa extracts can significantly reduce knee pain. And the mechanism of action here is highly specific. When these bioactive compounds enter the synovial tissues of a joint, they essentially mute the body's cellular fire alarms. They actively downregulate pro-inflammatory enzymes like COX-2 and cytokines like TNF-alpha. But it doesn't even stop at just reducing inflammation. The research points to a termosaccharide-mediated chondroprotection. I know that's a mouthful, but it just means specific water-soluble compounds in the plant actively help prevent the degradation of the cartilage matrix itself.
Now, what's really interesting here is the timeline. Multiple human trials show that over a period of just 12 weeks, patients with osteoarthritis show significant improvements in WOMAC function scores. Those are the scores that measure pain, stiffness, and physical function. And what's truly incredible is that clinical data suggests these improvements are often completely comparable to standard synthetic NSAIDs, but generally without those harsh gastrointestinal side effects. I mean, that is a massive win for joint health.
Let's move along and see how this builds into our next system, Section 2, metabolic and liver health.
Okay, so managing systemic inflammation is absolutely crucial for the very organ that filters our blood. And this brings us to a really fascinating concept, the gut-liver axis. This is essentially the vital bidirectional communication highway between your gut microbiome and your liver. Curcuma longa plays a major regulatory role here. Studies actually show it mitigates hepatotoxicity, which is just liver damage, by normalizing those crucial AST and ALT liver enzymes. And at the exact same time, it modulates inflammatory signaling along this axis by influencing bile acid production and balancing out gut flora.
Let's contrast an inflamed metabolic state, characterized by insulin resistance, elevated lipids, and oxidative stress, with a Curcuma longa-supported state. Research highlights that specific active compounds, and actually scratch that, not just curcumin, but synergistic players like bisaccharone and beta-alanine may help support your glucose and lipid metabolism. They do this by inhibiting enzymes like PTP1B and DPP4, and that directly improves insulin signaling and helps normalize blood glucose levels.
Moving on from the liver, we travel up to the command center. Section 3, brain and cognitive resilience.
Breaking down the specific phytochemicals reveals some highly targeted neuroactions. Curcuminoids are shown to upregulate BDNF, that's brain-derived neurotrophic factor, and phosphorylated CRB. So in simple terms, this means it encourages neurogenesis, the actual growth and differentiation of brand new neurons right in the hippocampus. Meanwhile, another compound, bis-dimethicue curcumin, shows really strong inhibitory activity against acetylcholinesterase, which offers symptomatic cognitive support that's actually very similar to the pathways currently targeted in Alzheimer's research.
There's a really profound quote in the scientific literature about this very process. It states that Curcuma longa is a candidate to buffer neuroinflammaging through antioxidant and anti-inflammatory pathways. Now, neuroinflammaging is that chronic low-grade inflammation of the brain that accelerates cognitive decline as we get older. And the data strongly suggests this botanical acts as a powerful, multi-pathway shield against this exact process.
Next up, we are examining the body's filtration and pumping systems. Section 4, cardiovascular and renal support.
At the organ level, these extracts demonstrate some brilliant protective power.
In models of drug-induced nephrotoxicity, specifically from really heavy chemotherapy agents like cisplatin, combined curcuma extracts actually preserve renal function. They pull this off by significantly lowering tissue-destroying biomarkers, specifically TNF-alpha, KIM-1, and caspase-3, which effectively halts cellular apoptosis, or cell death, in the kidneys. And on the cardiovascular side, the benefits are equally systemic. Curcuma longa helps normalize lipid profiles and improves overall oxidative balance in the blood. But perhaps the most fascinating part is its vasorelaxant activity. Specific sesquiterpenoids found in the plant, like curcumin A and B, actively block calcium influx into vascular cells. This essentially allows your blood vessels to relax and dilate, suggesting some really major potential as an adjunct in cardiometabolic disease management.
Finally, we reach our outer barriers and cellular defenses. Section 5, antimicrobial and tissue healing.
So, curcuma longa isn't just for internal systemic use. It profoundly impacts the skin and mucosal barriers too. Clinical studies on surgical and incisional wounds actually show that topical applications significantly improve read-a-wound scores. It accelerates wound closure by promoting angiogenesis, which is the formation of new blood vessels, and enhances basement membrane deposition at the dermal-epidermal junction. So it literally helps rebuild the structural matrix of your skin.
And while it's busy repairing tissue, it also acts as a truly formidable shield against pathogens. Research indicates it inhibits both gram-positive and gram-negative bacteria. It actively disrupts those pathogenic biofilms that make bacteria so resistant to traditional treatments, causing nucleic acid and protein leakage right in the bacterial cells. Furthermore, the volatile oils and protease fractions within the plant demonstrate potent antifungal activity, particularly against stubborn strains like Candida.
Bringing this entire journey into focus, the data proves that curcuma longa is a highly complex botanical matrix. It's not just a single, isolated molecule. You've got curcuminoids handling the joint and brain pathways, polysaccharides like leuconin, modulating macrophages for immune and joint support. And the volatile oils, the turmerones, well, they are the heavy hitters for antimicrobial defense. It's exactly this phytochemical synergy that provides such broad-spectrum therapeutic benefits across the entire human body.
All right, bringing this all together for our final scientific summary. The overarching therapeutic power of curcuma longa ultimately relies on its exceptional general antioxidant capacity. By neutralizing free radicals and preventing oxidative DNA damage right at the cellular level, it protects the architecture of our joints, liver, brain, heart, and skin from the ground up.
Just a quick note on our educational disclaimer here. This explainer is strictly for educational purposes, based on current preclinical and clinical research, and it is not intended to diagnose, treat, or cure any disease. Always be sure to consult with a healthcare professional regarding any medical conditions. But hey, if you found this scientific deep dive valuable, please hit subscribe and leave a comment below letting us know which mechanism surprised you the most. So the crucial point I want to leave you with is this. As modern clinical science continues to map out these incredibly precise molecular pathways, it forces us to ask a much larger question. How might we rethink the role of complex, multi-targeted phytomedicines in our modern therapeutic protocols? It's a truly fascinating intersection of nature and hard data. Thanks so much for learning with me today. SEO output required. 1. SEO-optimized YouTube title. The Clinical Science of Curcuma longa, Therapeutic Benefits and Cellular Mechanisms Explained. 2. SEO-optimized description. Discover the peer-reviewed therapeutic benefits and clinical pharmacology of curcuma longa, turmeric, in this deep-dive educational documentary. Skipping the traditional folklore, we explore the hard medical science behind how active phytochemicals, like curcuminoids, terminal and volatile oils, interact with human cellular pathways. From down-regulating COX-2 in joint inflammation to modulating the gut-liver axis and acting as a neuroprotective buffer, learn exactly how these compounds function on a molecular level. Disclaimer: this video is for educational purposes only and does not claim to diagnose, treat, or cure any disease. Subscribe for more evidence-based phytomedicine explainers. 3. 15 SEO tags. Curcuma longa, curcumin therapeutic benefits, turmeric science, phytomedicine, curcuminoids mechanism of action, joint inflammation relief, osteoarthritis clinical trials, gut-liver axis, turmerosaccharides, neuroinflammaging, BDN upregulation, natural vasodilators, plant-based antimicrobials, medical botany, evidence-based herbalism. 4. Thumbnail text ideas. Turmeric's medical science, Inside the Cells, Curcuma longa, The Science of Curcuminoids, Not Just a Spice, the Clinical Data.
5. Suggested chapters/timestamps. 00. The cellular hook and introduction. 115. System 1. Joint pain and inflammation. 330. System 2. Metabolic and liver health. 545. System 3. Brain and cognitive resilience. 790. System 4. Cardiovascular and renal support. 1005. System 5. Antimicrobial and tissue healing. 1220. Final scientific summary. 1345. Educational disclaimer and conclusion.